Hi, I'm Dr. Nicole Sheehan. I'm an acupuncturist and an herbalist for animals. Here today treating my own dog. I'm in my home studio. My little doopy dog, my favorite little famous guy. He's got a long back, and he's gotten older. He's 11 now, and so he is a bit prone to back problems, and so he needs treatment today. So I thought I would just go ahead and show you guys what a treatment looks like for a dog with back pain. He doesn't love acupuncture, but he does love laser, and so we're gonna do both today, so you can see kind of how we go about it and him feel. So, Doopy, you want to come up and have a treatment? Hi, good morning. Come on. Yeah, come on. Come on up. Oh, that was kind of tough. Not for you, Boaz. Not today, honey. You go place on your bed? That's a good boy. That's a good boy. Place. No good. We're not having snacks. We're not having snacks today. Okay, go place. All right, Doopy. Doopy's my sweet little sad guy. Hi. I know your little back hurts. I know it. I know. Boaz, you are being so nosy. All right, so Doopy's a worrywart, so he's always worried whenever I turn into a veterinarian and not mom. He gets nervous, so it's okay. It never hurts you, right? So the whole thing about Doopy, his name is Cooper, by the way, but we call him Doopy because that's every animal in our house gets a silly name. And so he's got this really long back, and so over the last year and a half, sometimes he'll aggravate it. We're pretty active. He's still really active with me, and so he just gets a little bit painful. So he's due for a treatment. The reason I know he needs it, just a little tiny touch. I don't know if you can pick that up on camera, but I know, baby boy. Just a little tiny touch in some of these acupuncture points, and he is so tender, and so you can just see like I'm barely touching him, and he's just really tender. And so dogs like this, like, they really benefit from acupuncture because what's happening on that is all these little nerve endings that are coming out of this spinal cord are aggravated, and they're sending all of these aggravations down the body. And what happens is most of the time there's just like one spot that might have an actual problem, but what happens is your spinal cord is so important that your body tenses up in an effort to protect it. And so what ends up happening is you might have a problem right here, but then it ends up hurting here, everywhere. And so before you know it, the whole back hurts. So before I go putting needles in these spots that are so painful, I'm going to go ahead and do a laser treatment on it first, and then we'll put some needles in after. And so I'm going to get going on that. And so this is a Summit laser. We have a human laser at our house, and so that's what I'm going to use on him today, and I can adjust it for dog settings. At the office, we also have a Summit laser, and it comes set immediately with dog and cat and horse settings, so it makes it really easy. And then with the laser, we have to wear protective goggles because it's not good for our retinas if you look right into it. So it's a good habit when you use a lot of laser to be always using that. And then what this is going to do is it's going to emit a small wavelength to his painful areas. I do not have to touch his skin in order to take advantage of it. And what the laser does is it reduces the inflammation in the area, and then it also directs the blood flow. So our blood is what heals us. It's got all these factors and cells inside the blood that come in and kind of repair things. And this creates a temperature gradient so that the cells know and the blood supply knows to go in there and start cleaning things up for us, which reduces the inflammation and overall the pain. And then any damage that's there, it directs the body to go in and go ahead and start cleaning things up for us. It's usually very relaxing for dogs, as you can see. He's very happy. I have a warm laser. You'll hear something about cold lasers. That's a little bit different class of laser. I've been using the warm lasers forever, and so that's my preference. I'm just used to it, and so that's usually the laser that I stick with. But it can get hot if you keep it in the same place, and so that's why we're kind of moving around. What's really interesting about a laser is you can even treat animals from far away. Like you can treat an aggressive pet as long as that red light gets to them. And so again, you don't have to touch the body. I can still treat him like this and not have any problems. And so the laser is really versatile. And so usually if the animal's happy enough to have a treatment, you'll see us, being pretty close up and moving it around and directing blood flow and all that. And then his main problem is up here, but what's happening is he's starting to get lower back pain. And so I'm gonna hit up some of that lumbar spine too. And then after we're done here, the treatment itself is only 7 minutes. And so it's really quick to get some results. And so pretty much universally they'll feel better after one laser treatment. And for me, that puts me in a position where I can then go ahead and put some needles in. So I think the acupuncture needles are more beneficial for the nerves. I do really love laser for the rest of the tissue. So I love it for arthritis. I love it for muscles, so muscle spasming, that happens with back pain, connective tissue, things like that. Anything that can get inflamed. But I really prefer for long-term results the acupuncture needles for the nerves. So my goal is always to get some acupuncture needles in. Now sometimes you'll have animals that are so painful, you basically have to start with laser, send them home some anti-inflammatories and bring them back in a day or two to be able to appropriately get needles in them. If they're too tense while they're getting needles, it can actually cause their backs to cramp even more. Like if they're holding it just so tight, trying to protect themselves against needles, and it's really counterproductive. You'll see her in a minute. Usually my standard treatment for back pain is anywhere from 18 to 20 needles. He's sensitive about it. He doesn't love having it done, which I would say is only about 10% of animals. Probably 9 out of 10 animals absolutely love it. And so he doesn't love it, and so I minimize his treatments down to only about 10, maybe 12. But I don't want to push him too far, otherwise it's really kind of counterproductive. So we're down to less than 2 minutes on this laser treatment. Sometimes you'll see me kind of pushing on some areas and seeing where does it still hurt. There's a setting on here which is really brilliant. There's an acupuncture setting on here. And so the other thing I'll do sometimes as animals get really old, they get what I call prickly. So about 14, 15, and the connective tissue just gets tighter over time. Dogs that love their needles start to not love their needles so much. And if they get a little prickly when I am doing their acupuncture, then I'll switch over to what I call aculaser, and I'll use the laser on the acupuncture points. So I can still target those acupuncture or acupressure points, but I'm using the laser on them. And you'll see me just sit for 20 seconds and then move to the next spot. And so that's another technique that I'll use sometimes. I may have to do that eventually with Doopy because he just really doesn't love having needles done. We're going to do this laser, and then I'm going to go through and we're going to test his tissue again and see how much difference we made in the laser before we do needles. Let's see. Very relaxed. So that's one of my favorite things about the laser. Probably the least favorite thing about the lasers is very expensive. So people ask me all the time about at-home lasers, if they can buy one. And I don't have any that I have in particular that I like, because you may be looking at maybe $1,000 or $1,500 investment, which is quite an investment for most people. This laser is a $30,000 laser, and so you can imagine that investment is not doable for most people, and that's why the lasers that you'll see in the vet hospitals get kind of costly, but are still cheaper to do than buying your own laser at home. Probably the at-home lasers might do a little bit, but if you think about like the power that comes out of this machine, you might have to laser quite more often in an effort to get results. So that's all it was, one laser treatment. Sometimes I'll break it up if a dog is super painful. I'll do one treatment here and then one treatment on the other area. With him, I know for him that this is not his main area, so we just add that in. So now I'll go through and kind of see. Yeah, he's still pretty twitchy in here. Yeah. So better back here. Now before I do needles, I'm going to do a little bit of massage actually. This is something people can do at home and is actually really valuable, especially a lot of times you'll treat with the laser and you'll go back through and literally they don't hurt anymore. And I have a lot of patients that are like that. So what this tells me is this tissue is still really tight even after a laser treatment. The laser treatment works so well that if it doesn't give me everything that I'm looking to get, then I know I've got to do something different. And so there's a couple of techniques that you can do at home. You know, when you massage dogs, they're like kids. You know, he's only 40 pounds. So think of him as a 4-year-old child. You're not going to just grind in there on their muscles. And if you do something like that, the body, again, it tenses up, and it tells, you know, the body is telling the muscles, like, you need to protect yourself. And so you got to be careful not to push too hard, but animals will tell you exactly what they need. And so there's kneading techniques where you can just find those ouchy spots and just find a nice steady pressure that loosens up that tissue. One of the things that tells me about that Cooper has not needed, but he probably does need, is maybe some collagen. And so when the tissue is still tense after laser, that tells me that the connective tissue is sometimes a problem. And so I can tell you, after doing his laser today, we're probably going to start some collagen today. And that can loosen up that connective tissue. And so you can see he's definitely a fan of this too. Most dogs love massage. And there are certain massage techniques. I do actually have a massage class that I did and put online for people to do. But a lot of it is just really being responsive to the animal and just watching them. So his breathing has picked up a little bit, so I gotta be careful not to go too far. Just like if you had a deep tissue massage, it's the same thing. Like, sometimes you gotta breathe through it a little bit. I might be pushing his boundaries a little bit. I don't want to go too far with it. And then he's gotten pretty comfortable. So now I gotta work on the other side of his spine. I'm just gonna do a little bit more, and I'm gonna show you one other technique, and then we're gonna try to get some needles in him. Good boy. I know, it's a little ouchy back there, isn't it? So I'm over that back side, lower lumbar spine. I'm pushing it a little bit, so I gotta back off. He's showing me a little bit of, maybe a little too much, so I'm gonna back off a little bit. All right, mister. Oh, I know, that feels pretty good, right? The other technique you can do at home is called rolling. And you actually roll their skin off of their body. And you'll see in places that don't hurt and aren't tense, the skin rolls off the body really easy. And when you get to the areas that are tighter, you'll actually see where the skin is starting to connect to the rest of the body, and that's not good. We want things to be really fluid. And so really gently, you don't squeeze the skin, you're just literally rolling it off of the body in a really gentle way. And some of you might be really surprised to see how tight this is. And you can pick another area, like his hips aren't tight, and it's really easy to pick up that skin, but all along here he's starting to tighten up. And so I'm just going to loosen some of that up, and then we're going to run through and see how he feels again, and then we'll put some needles in. So far all of this, he's about snoring, so all of this feels pretty darn good to him, but I do feel some areas of tension. And so these are things that people can do just sitting and watching TV and having your dog be with you, and just rolling the skin usually feels so good. And you'll feel over time, you know, if you do this about every other day or 3 days a week, a couple weeks in, you start to feel everything kind of loosen up, and then you see a lot less of that twitching. Something clients ask me about all the time is like, I'll go through and say, you know, can you see that your dog obviously has back pain? They're like, no, my dog just does that. That's just a thing my dog does. That they shouldn't do that. So when you touch them and their whole back tenses, that's not because they're ticklish. So if you look at a dog that doesn't have any back pain, they could care less. They will let you do that all day long and not twitch at all. Hey buddy, I'm just gonna move you a little bit. Hi, are you getting so nice and comfy? That's nice. Can I put some needles in you? I'm just gonna scoot you a little bit, okay? It's okay. Hi. So for me, I know this might seem silly, but dogs do better, and cats, gosh, especially cats, they do better if they kind of know what's going on. And so even if I've needled an animal 10 times, I still always kind of show them what's going on and what I'm going to do, and ask, you know, for their permission to do that. And it's less shocking than just approaching them and just popping a needle in them. So the way that I acupuncture, everyone's a little different. There's definitely an art to it. I use a combination of Chinese medicine and dry needling. And so dry needling would be the Western approach of wherever it hurts, there's a little nerve that's not happy there. And so I'll put a needle in that area and get that area to calm down. And then I'm also using some Chinese medicine points, which have really specific kind of nerve centers that impact the body. And then everybody kind of has like what's called a permission point. And that's kind of like a tester point. So you're trying to see, you know, really how is this animal going to respond. for a lot of acupuncturists, their test point is GB20 up here, which is like a stress point. I don't actually really use it. I don't need it in most animals. In Doobie, it's going to be good though, because he's a nervous dog, and so it's kind of like a calming point. And so I am going to start his permission point there. And what that does is it kind of allows me to see what is his tolerance for needles. So he doesn't love it, and so you see him get just a hair agitated, whereas most dogs could care less about that point. That gives me some indication about how he's going to accept needles. My normal permissive point is in the back. It's called Baway. For animals, sometimes people equate this with GB20. So GB20 is in humans, is the closest point to the sun. And so that's a really big point for us as humans. In pets, when you think about animals, they're often have their nose to the ground. And so often the top of their hips is their closest point to the sun. Hi. So again, most pets don't care about that point. So what this does is this tells me how tolerant he's going to be. So these are the two easiest points in the body. They're the two most comfortable points in the body. Anything that gets more close to his ouchie points is going to be something that he's going to be a little bit tender to. And then animals, if you've ever, as a human, had acupuncture, you'll notice your acupuncturist often uses mainly your distal points, so your arms, your hands, your feet. Animals don't tolerate those as well. And so if an animal is barely tolerating me putting needles in their two permissive points, he's not going to tolerate me putting things in his ankles and his feet and things like that. And then for him, I may not even be able to get to his main ouchie point because it might be too tender for him. So I am going to work some points I know are not primary points and see if I can get some of his back to calm down. And so another technique I'll use is just getting them distracted. If you have an assistant, they can do peanut butter or treats. Hi. Here. I know. Yeah. Okay. So once there's a needle in, it's in the muscle. And so if they move too much, it aggravates them. And so when you have dogs, most of my patients just sleep through their treatment. And if they do that, there you go, buddy. If they do that, then they have no twitching whatsoever. For a dog that is more nervous about things like Cooper, and he moves, he's going to feel it even more. And so I always keep a hand on them to keep them nice and calm. All right, buddy. Let's see if I can get a couple more in you, okay? I got you. I got you. I got you. I got you. It'll be worth it. It's okay. I won't do too many on you, okay? Yeah. And so I would say, obviously, he's the 1 in 10 dogs that doesn't love it. It's okay. And we're going to talk about what we're going to do about that after this treatment. And so you just really have to take your time. And that's half of what I do with animals, is just listen to them. So the animal has to be part of the treatment. Otherwise, the treatment is not effective. So we're just going to give him a minute. You're a good boy, Doopy. Good boy. And so my goal is to get 2 more in him. So I'm probably not going to get to his main points, but if I can take away the pain in that lower back and then up in his shoulder area, it's going to do a lot for him. And then we'll talk about what am I going to do after, because he is not going to tolerate many of these. Sometimes noise helps. Good boy. Last one, okay? Good boy. Okay. So I'm not going to push him too far. So if he's sitting on edge the whole time, it's not going to do much for him. And so my goal for his treatment, for a lot of these dogs, so he got he only got 6 needles. Most dogs are getting 20 and absolutely loving it. And I'll do another video of a dog who just absolutely loves it and melts into it. But I think it's really important to only do kind of what an animal will allow you to do. It's okay. I'm not going to touch your feet. I'm just trying to make you comfy. Fine. You're a very good boy. You're a very good boy. Huh? So now I'm going to try to get him to relax. So then those 6 points that we did get in actually have benefit to him. Sometimes I'll sit and massage the other areas. So we'll be here for usually 15 minutes or so. Sometimes 30 if I have an older dog and they're loving it. I'll leave the needles in longer. So for him, I'm going to take advantage of this time and just work on some of that massage on these acupressure points. And so instead of using needles, I use my finger and do massage in those acupressure points, the same points I was going to use for needles. And these are all of the ways in which we adjust for them to get the most effective treatment. So let's talk about what else I'll do for him, because this is not going to be enough treatment for him to get relief, because I haven't even been able to get into the main area. So we talked about collagen. So after laser, if they're still really painful, that means all of their connective tissue holding all their muscles together hurts. And so I'm going to start him on collagen today and see if I can improve that connective tissue. Usually that works quickly. So when you have like a joint problem and you start joint supplements, that can take a month to really get in full amounts into the joint, like glucosamine, chondroitin, things like that. Collagen works rapidly. And so sometimes within 2 or 3 days, if that is the right course or the right supplement that you need for your dog, you'll see that pretty rapidly. You may see it in improved mobility, motion, things like that. Mobility has a lot to do with everything. So until you get the back feeling better, you may not see it right away. Where you may see it immediately within a few days is less twitching. Oh, I'll stay away from that spot. Good boy. Good boy. So again, he's just fully communicating with me and I'm fully listening. And that is probably the most important thing I do. So I was getting kind of close to the needle up there and maybe moving that needle a little bit. He's sensitive too because he's being really sensitive with the needles. So I'm just going to move away from the needles and get back down into that middle back space. So anyway, we'll start some collagen, and probably if I go through and I test his connective tissue, all of this connective tissue holding all of his skin and axial or spinal muscles together, I'll probably test that in a couple days and see, maybe after the weekend, are we having some impact there? And then the other thing I'm going to do, so I don't do chiropractic for dogs. I have access to people who are trained in chiropractic for dogs and cats. And I utilize their services for my own dog and then also for my patients. In the way people always want to know, like, how do you know what to do? Laser, acupuncture, chiropractic. The reason I think any of those things are always good for your pets, but I'm always looking for, it's expensive to do this. And it's also hard to lug your dog around. It's hard to take time off of work. All those things that we have to work against to take good care of our pets. So I'm always somebody who's trying to go immediately to what works. And so I know for sure an animal needs chiropractic when I've treated them with acupuncture and those points don't feel better. So, or if they only feel better for a few days. So let's say I do acupuncture and I check their points afterwards and they feel great. And then they go home and their parents are just floored by how well their animal is doing, but it only lasts 2 or 3 days. That's pretty normal the first treatment. After the second treatment, though, it should last longer. After 4 treatments, the animal should feel good. If they don't feel great after 4 acupuncture treatments, then I know I gotta switch to something else. And that's one of my red flags that tells me they need chiropractic. And so if something is out of alignment, if the spine is out of alignment and it's pushing on these nerves, you can get those nerves to calm down with acupuncture. You get the tissue to calm down with laser. You get the nerves to calm down with acupuncture. If they still hurt, that means that something's twisted in there and it keeps pushing on those nerves and those tissues, pulling on the muscles. So if I do a treatment and they don't feel hardly any better, that tells me something's out of alignment. And so I can already tell that that's going to be in his future. And so my next step after today is starting collagen, and then I'm going to call the doggy chiropractor and we'll get him adjusted. Animals adjust out like children. So if you have 11-year-old dog, that's old for a dog. But if you think about him, he's only had 11 years of any kind of tension in the body. So they adjust out really quickly like children do. And so he would adjust out kind of like an 11-year-old kid. So usually a couple treatments and they're ready to come back to see me for a recheck and maybe another acupuncture. I could tell you Doobie just does not love his, and so we're going to respect that. So next I would get him adjusted. I'm guessing it would take probably two adjustments for him. We'll get him adjusted out, start collagen. And then what I would do is I would take the laser and I'd put the acupuncture setting on the laser. And I would treat him on his acupuncture points with the laser, because you could see how much more responsive he is to the laser. That's kind of it. So now that he's settled down, now that there's, not putting new needles in him, he can, usually if you just sit with them, they'll sit and relax through it. Dogs that love acupuncture are adorable because they just kind of slump over and lay down, and they literally just love it. They don't want to get up. I've got dogs that I can put needles in and leave the room, and they'll just literally lay there for a half hour. It's really sweet. And then horses, if you have horses, my gosh, it's the most incredible thing. There are these tiny needles. So the needles we use in horses are the same size as the needles we use in dogs. They're longer, but they're no bigger around. And you treat a horse, and as soon as you hit their points of tension, they just drop. Now, you can have spicy horses that don't love it. And so I've got a couple horses I've treated over the years where I'll get one needle in, and then I run like boom, and you put it right in that spot that hurts, and you back off so you don't get hurt. And if that needle can even be in there for 5 minutes, it can immediately relieve the pain in that joint or that area. But a lot of horses, about 9 out of 10, similar to dogs and cats, will just absolutely slump into it and fall asleep standing up, and it's really beautiful to be able to impact such a huge animal so rapidly. Again, 20 minutes of needles is all it takes. Horses do great with massage too. My goodness, you can really feel the areas of tension that they carry and release it pretty quickly with acupuncture and massage. So it's one of my favorite things when I get asked to go out to a horse farm and take care of horses. It's really, really fun. So you probably need about 5 or 10 minutes, then we're going to pull these. So I think that's kind of it for Cooper today. Not much else is going to change, other than I'm going to let him take a nap for 5 or 10 minutes, and we're going to go ahead and pull his needles. But I think really the takeaways are, I always think the takeaway is going to be the medicine, but the takeaway here is like, listen to your patient, because if they're not into their treatment, your treatment is not going to do much for them. And so that goes for people with acupuncture too. If you think it's not going to work, it's probably not going to, because you're not going to allow it in. And so it's really like, just honor your own self and the things that you believe in and the things that your pet wants to be a part of, and just honor that. And I think that's the biggest takeaway here. And then the other takeaways, again, like for arthritis, besides supplements are my favorite for arthritis. My second favorite is laser. For back pain, laser is my second favorite treatment, just because it gets some of that inflammation down, but acupuncture would be my favorite treatment for back pain. And then if they're not responding to laser and acupuncture, the next step is usually chiropractic. And then massage is always good, because who doesn't love massage? So that's kind of my rationale for my mobility treatments. So thanks for being a good sport, Doopy. So we're back with Cooper, and he is still napping. I just took his needles out, so he's got nothing on board. And I'm going to go back through his spine and just see kind of where we are with things. This is where he was not happy with those needles, and it's gone. And so I can really push. Before, I could just barely even touch him and everything would cringe. And as I go down, what's really surprising is this is his main area, and I couldn't even really target it. I could target it with the laser, but I couldn't target it with the needles because he wouldn't tolerate it. And it's gone. And so all of this, I'm actually pushing harder than I was. And then I go down in this lower back, which I was surprised was painful this morning, but was. And I can really push. I had needles back there too, if you remember. But all of this is gone. So I'm actually shocked, because he would only allow 6 needles. But that's the power of laser plus massage plus acupuncture. And one of the beautiful things is you can be doing massage at home and just making your pets feel better just with that. And so, wow, that's a lot of what I did there in that spot. The other thing that you can do if you don't have access to a laser is like a heating pad, just like people feel good with a heating pad. And so if your animal will tolerate it, it's all about listening to them. If they like it, don't put it on too hot. Don't do it when they're sleeping. Don't do it for older animals that can't get up and move away from it if they're too hot. But just putting a little heating pad over their back can also just loosen this. And then you can go through and massage just as I was, and you can actually get some results just with that. So actually better than I thought for 6 needles, but that also shows the power of acupuncture in doing this, and then the power of doing multimodal strategies. But I am going to start the collagen still, and I am still going to call the chiropractor, because I know that in 2 weeks he'll just hurt again if I don't get everything aligned. So I'm going to go ahead and get that going for him too. So that's it. Thanks so much. Thanks, Doobie.